Good morning. Today we'll be dealing with the edentulous state in our mouth. What is edentulism? It is defined simply as the loss of natural teeth. This loss may be complete loss of the upper and lower teeth, or it might be a partial loss of teeth, as shown in the figure. Now, what are the common causes of tooth loss? The most common ones are gum disease, dental decay, oral trauma, some chronic illnesses, and a few lifestyle factors. Now let's see each of them in detail. The first one is the gum disease, also known as the periodontitis. It's an infection that damages the soft tissue of the tooth. Now, we can see plaque, tartar, and bacteria which build upon the teeth, which cause inflammation and infection below the gum line. If subsequent treatment is not done, the periodontitis will destroy the bone that supports the teeth, causing the tooth to loosen and finally lead to tooth being replaced. Now, what are the symptoms of gingivitis or gum disease? You will find red, swollen gums. You will find deposits of plaque or tartar. You might have a bad breath. On brushing, you will find that your gums are bleeding easily, and you will have sensitivity to heat and cold food. You will also have tenderness or pain on your tooth, and sometimes even while chewing. Now, coming to the next, it is the dental decay. Normally, a dental decay can be treated with a tooth filling, or when the pulp is infected, a root canal can be done. However, if the dental decay doesn't get treated, it will require, in severe cases, a tooth to be removed. Now, coming to the oral trauma, there are some conditions. Example, for school children, while they have in their playing activities, they might trip and fall. Sometimes people might get into motor vehicle accidents in which there is trauma to the teeth, in which the tooth may be lost completely or may be fractured. It may also occur in contact sports if you are not using a mouth guard. Sometimes a habitual teeth grinding, also known as bruxism, or habits like chewing on ice can also cause tooth trauma. Frequently using our tooth as tools for opening bottles, using pins, opening pins, etc. can also lead to tooth loss. Shown in this picture is a class 3 fracture or a class 4 fracture in which the pulp is exposed. This usually happens conditions in which a child falls. The second is a case of a motor accident or a road traffic accident. Similarly, when you have a contact sports, you might get some injury. Now, people with bruxism or night grinding may also have tooth which have fractured due to excessive abnormal load. If you also use your tooth for activities other than that of the normal chewing, like opening the bottles, etc., might cause fracture of a tooth. Certain conditions like uncontrolled diabetes, high blood pressure, rheumatoid arthritis, bone disease, etc., can trigger or accelerate the gum disease and cause tooth loss. Lifestyle factors like deficiency of essential vitamins and minerals, including vitamin A, D, calcium, phosphorus, potassium, iron, etc., can cause gum disease. Similarly, the use of tobacco can also cause tooth loss. What is the impact of edentulism on oral health? Tooth is surrounded by bone. When a tooth is extracted, there is bone loss. There is a reduction in the height of the alveolar bone. If you consider tooth root and the surrounding alveolar bone, once the tooth is removed, the jaw bone height decreases to a normal level. Impact on adjacent teeth. When a tooth is removed, the opposing tooth tends to grow downwards or supra-erect. Now, the tooth which are on both sides of the same arch, they tend to tip towards the space created, and so does the other tooth. So, losing a tooth, if not replaced, will cause changes in the surrounding tooth as well, causing inefficient chewing. What is the impact on oral musculature? You have an impaired masticatory efficiency. If you consider a person in which all of the teeth has been removed, it is been found that only 1/5 to 1/4 of the bite strength and masticatory force remains. Similarly, the thickness of masseter muscle, which is the most important muscle for mastication, is also found to be decreased. The masticatory ability is also affected. The complete denture wearers require 7 times more chewing strokes to reduce food into half the size when compared to the normal. Now, there are few conditions which are associated with use of a denture or edentulism. You have denture stomatitis. A patient is wearing a denture and the area below the denture placement is affected, is inflamed. Similarly, patients with a full mouth loss of tooth will have angular cheilitis. Similarly, oral candidiasis. All these conditions are predisposed by the use of a denture or due to complete edentulism. So there is also a change in functional and the sensory deficiencies of the oral musculature and salivary gland. The total saliva production is also decreased. As we've seen, there is increased risk of stomatitis, that is inflammation of the oral cavity, angular cheilitis, oral candidiasis, and oral dyskinesia. Oral dyskinesia is defined as an abnormal, involuntary, pattern or stereotyped, purposeless orofacial movements. This happens due to the loss of tooth. Now, what is the impact of edentulism on general health? Due to the absence of a full set of teeth, there may be a change in intake of fruits and vegetables, fibers, and essential vitamins like carotene, and increased cholesterol and saturated fat, which leads to obesity and increased risk of cardiovascular disease and gastrointestinal disease. There is also chronic inflammatory changes in gastric mucosa, which can lead to gastrointestinal and pancreatic cancer with higher rates of peptic and duodenal ulcers. What is the impact of edentulism on general health? There is increased risk of ECG abnormalities, hypertension, heart failure, ischemic disease, stroke, aortic valve stenosis, and heart disease. Similarly, there is an increased risk of non-insulin dependent diabetes mellitus. What is the impact of edentulism on general health? Due to the decreased food intake, and there will be decreased daily function and physical activity. There is also increased risk of chronic kidney disease. Due to the loss of teeth, there is sleep disordered breathing, including obstructive sleep apnea. Now, the mechanisms which link the poor general health and the tooth loss are not clear. The mechanisms linking poor general health and the tooth loss are not yet clear. A pathway for this association involves deleterious effects of the tooth loss that happens on the nutrition and that in turn impacts systemic health. Edentulism negatively influences not only the oral function but also the social life and the day-to-day activities. People with loss of tooth may be less confident and will find difficulties in their social life. Coming to the human dentition. The human dentition contains different sets of tooth. The incisors, the canines, the premolars, and the molars. You have a maxilla and you have a mandible. The total number of teeth amount to 28 or 32. 28 in case of absence of third molars and 32 in case of presence of all the third molars. In the maxillary arch, you will again find incisors, total 4 in number, canines, 2, premolars, and finally the molars. Similarly, in a mandible, you will find the complementary set of teeth. Now, we have different conditions in which there is a loss of tooth. The anteriors may be lost in a maxillary central incisor. Anteriors are lost in maxillary central and a lateral incisor. A condition in which mandibular second premolar is lost, and a condition in which the mandibular molars are lost. The loss of mandibular molar creates maxillary molars to drift to the place, causing supraeruption and loss of tooth space. Now, what are the different ways of replacement of teeth? We are coming to the first one, removable dentures. Dentures which can be removed by the patient, which might be partial, replacing only a few number of teeth, or maybe replacement of full denture, replacement of full set of teeth. Sometimes some people opt for fixed partial denture, which are supported onto the tooth. When there is an area of edentulism, the nearby adjacent tooth are prepared minimally and a bridge or a fixed partial denture is fitted onto it or cemented onto it. Implants are the latest we'll find single tooth implant, multiple tooth implant, and denture supported with implants. These are already fixed onto the tooth and provide a better retention to the oral cavity. How can we consult our patients regarding edentulism? Losing a tooth can affect the bite, the speech, and appearance. Similarly, the loss of a tooth causes a change in bite and difficulty in chewing. There are also speech problems. In addition, it can make our smile look unnatural and less attractive. Losing a tooth causes problems with jawbone and overall health. Bone loss occurs and later might become difficult to wear dentures and implants. The missing teeth also lead to gum disease, which can cause your teeth, gums and bones. There are different types of tooth replacement options like dental implants, bridges, fixed and removable dentures, etc. The replacement of tooth can help to improve the quality of life. It will help you to chew the food properly, speak clearly, and have an improved smile, which can boost the self-confidence, which will make it easier to eat, socialize, and to participate in activities to enjoy. Thank you.